Welcome back dosto. Today let's learn about temperature associated injuries.
Let us start with heat cramps. This happens due to electrolyte loss, mostly sodium, from sweating, and the core temperature may be normal or near normal. Painful muscle cramps will be there in the calves and abdomen. Heat syncope. This occurs due to peripheral vasodilation plus dehydration, which leads to decreased cerebral perfusion. It presents as fainting in hot environments, and the skin is usually cold and moist. Next is heat exhaustion. This is the most common heat illness. It is inability to maintain cardiac output in heat. The temperature is less than 40 degrees centigrade. Heavy sweating is present with tachycardia. No CNS dysfunction is seen in this case. Next is heat stroke. This is a medical emergency. In this, the core temperature of the patient is more than 40 degrees centigrade plus CNS dysfunction is seen. The causes may be exertional or non exertional. Features include altered mental status, seizures, coma, and the complication can be DIC, rhabdomyolysis, ARDS, and renal failure. Next, let's talk about cold related injuries. First is frostnip. This is mild and reversible case where no ice crystal formation is seen. Numbness or blanching of the skin may be present. But in case of frostbite, freezing of the tissues with ice crystals that is cell death is seen. Stages may be superficial or deep. Hard, pale, waxy skin may be seen. Blisters may be present after rewarming. The treatment is rapid rewarming in 37 to 39 degrees of water. Next is trench foot. This happens due to prolonged exposure to cold or wet water that is 0 to 15 degrees centigrade. It may cause neurovascular injuries that may cause numbness, edema, and blisters, but no freezing is present. Next is hypothermia. This is the decrease of body temperature than the normal levels, which can be classified into three categories: mild, moderate, and severe. Mild hypothermia means the body temperature is around 32 to 35 degrees centigrade, where shivering can be seen. While in moderate cases, the temperature would be around 28 to 32 degrees centigrade, where there is decrease in reflexes and bradycardia can be seen. But in severe cases, where temperature is less than 28 degrees centigrade, ventricular arrhythmias and J waves may be seen, and the patient may even land up in coma. There are also electrical and radiation burns. In electrical burns, the heat is generated by tissue resistance, where the deep muscle injury is more common than superficial injuries, and there are risks like rhabdomyolysis and arrhythmias due to electricity. While in radiation burns, which is commonly called as sunburn, it is due to UV exposure, which might cause erythema and blistering. In severe cases, there may be systemic symptoms and desquamization. That's it for now. See you in the next video. Follow for more.